Cool. Let's look inside a pig. Okay, for the people at home, I'm going to get some assistance from the people in the room. We're going to take a look inside a pig. Mostly, we're going to be looking at the pig for the 3 major systems. So we're going to do respiratory analysis. We'll look at the lungs and the trachea and the upper respiratory tract with the pig. We'll look at the digestive system, esophagus, stomach, small intestine, large intestine, liver, pancreas if we can find it. And then we'll look at the circulatory system, mostly the heart. It's kind of hard to get into the peripheral circulatory system of the pig, but we'll look at the heart anyway, so you can see where it's positioned and how it's attached to the lungs. So, and anyone in here interested in getting in the pig? Throw a hand up if you're interested. Oh, it's like everybody, like a lot of people. Cool. Okay, well then I'll do very little here, and you'll do a lot. I'll try and get you up one at a time. Okay? Sure, that's totally fine. I don't mind at all. I am going to put my lab coat on. If you're interested in wearing an apron, I just want everybody to be able to see what's going on. Name it, sure. You can call it anything you like. You want to know if it's a boy or a girl first?
Yeah.
Either way, but when you're done, and after you dispose of your gloves, I'll bring a garbage. All right, there he is. Or, well, he or she.
Looks like. Oh. What is it? Jack?
He. It is a boy.
I like it. It has a nice ring to it.
It's got a nice ring to it. Oh, Fred. I'll get him set up, and then if you guys are curious, we're gonna more or less follow the procedure. I posted it on Brightspace there. If you look on the lesson for today, there's a PDF of the dissection procedure from the textbook. We're more or less going to follow that. I deviate a little bit, but I will tell you that these are, based on their size, are pretty close to birth. So I would say that they're just pre-birth. So it's a fetal pig, so they're unborn. This still has a umbilical cord here, but they are pretty close to birth. If you look at their weight and length, like if you look at a graph, they'd be like just pre-birth. So there are some positives and negatives to that. The positive is that everything inside is almost completely formed. So when you look in, it's like an obvious stomach and obvious this. If you get them really, really early, which we do sometimes as well, they're quite a bit smaller. But inside, everything just looks like Jello. Like there's like it's not like fully formed, so it's kind of hard to see what all the different parts are. I'm gonna have to break some bones here to get this tied down. So it does make a sound sometimes. I don't want to freak anyone out. No one's gonna like pass out or anything, are they? If you feel like you're gonna, just like take a walk, okay? It's happened. Yeah, it comes in like a box with like 100 pigs, so they're like squished in there. So yeah. Pig will. They were never born though, so it's not like this pig never felt any pain or anything. Never awake, poor guy.
Do you feel pain if you're like not born?
In utero?
Yeah.
Great question.
You have nerves, right? So.
It's fairly late term. They can be in distress. You know what? Let's not think about it too much. Possibly. I don't want to dive deep into that too much, but I don't want to cut in this big open. But possibly.
I'm not talking about the pig. I'm talking about it in general.
Yeah, in general for the unborn like humans, yeah. I mean late term, right? We're talking about fully formed nervous system, right? We're not talking about early term.
Yeah.
Third trimester, late third trimester, that's what this would be, so.
And you know who's going to good one.
Sounds
Hoping everyone can see this at home too, should be able to. I may have to bring my laptop over so the microphone.
Pigs have several pigs like that. Yeah, they do, right?
Sorry?
They have like litters, right?
Letters?
Litters?
They have
They have multiple pigs at a time.
Yeah.
Yes,
Yeah.
litters, sorry, yes.
All the pigs died?
Oh, they. These are, so these pigs are usually taken from a pregnant pig that is going to slaughter.
Oh.
So, yes, they are.
Oh yeah.
Yeah,
So it's like,
They're all these pigs were gonna die either way. This is not like they're not like purpose raised for this or anything.
yeah.
So I think this is just a way for a farmer to make like some extra money. It's just to preserve this. Or a slaughterhouse, I suppose. The hearts that we use for dissection I actually get from the slaughterhouse that's just outside of town. They give them to us for free, which is amazing. The guy that I know there is really awesome. He's like, what do you want? He's like, you want some kidneys? You want some hearts? they'll just get whatever. They'll just go on the floor and just like cut 50 hearts and give them to you in a big bucket. So, pretty handy. All right, so this is the pig right here. I've got him opened up. Oh, before we get into it, let's look at the upper respiratory tract. I'm just going to open up the mouth here.
Yeah, go ahead.
So I gotta be careful because the teeth are a little bit sharp. Sorry, this is gonna break a little bit. It's gonna sound gross.
Oh yeah, good.
Yeah.
Oh yeah.
Yeah, I'm rotating things a little. Apologies, I know it's kind of gross. All right, there we go. So if we look down, this is obviously the tongue down here. You look down here, you can see a big.
Oh yeah. That's tough.
This is the tongue right here. Yeah. My tools. You can see a big tube at the front. Okay, can you guys see this flap that I'm poking? Right here.
You put flash on.
See that
Yeah,
flap?
is there a flash?
Because it's kind of hard to see.
Man, it'd be awesome if we could turn a light on this. Did anybody comfortable coming up and
Yeah.
giving me some light? Do you have like a phone?
Are you sure you're comfortable? Yeah, Alex.
Oh yeah, I can.
Shine some light in there. Shine some light in there. Ah, perfect. Yeah. Okay, can you guys see that little flap right there?
Oh yeah.
See that? So that's the epiglottis. So that's the flap that is going to fold over and cover the trachea when there's swallowing happening. Okay? So obviously if that's the epiglottis, then if you go behind the epiglottis, that's the esophagus. Okay? So if I poke this all the way down, that would go down into the stomach. Okay? Go all the way down through the torso, through the thoracic cavity and down into the stomach. And in front of it, if I go in front of the flap, right here, and where do I want to go? Oh, actually, sorry, I had that totally wrong. So if you go back behind it here, again, that's still esophagus, but if we pull the flap up, and I go underneath it right here, there we go, now I got it. Then we're into the trachea, the front. Okay, so the trachea is open all the time. Obviously, it's got those cartilaginous rings holding it open. Whereas, so it's very easy for me to slide the probe into it. It's basically just sitting open in the front. But the esophagus is closed, so you got to push it open. It's your esophagus is just like sit open like a tube. There's nothing holding it open, so it's pretty flexible. Okay, so that's the upper digestive system and respiratory tract here, the mouth, oropharynx. This would be oropharynx right here. Tongue. We're not going to get up in the nostrils. They're kind of a pain to open up there, but there's sinuses up there as well. Pigs breathe through there too. Okay, now, who wants to cut in this pig? We're going to go and do the abdominal cavity first. So I'm going to do digestive system first. You want to grab some gloves then? I'll try and spread the cutting out here. We've got a big class and one pig, so I'll get you to make a couple cuts and then I'll get somebody else up here to make some more.
Are there two sides of the
Are there?
I think, yeah.
There are, yeah. So you can just toss that. Large and medium. Yeah, if you've touched it, I would just toss it.
Okay.
Yeah, sorry. You gotta be careful with that stuff now. So I'm gonna give you the scissors is probably the best way to do this. We could do it with scalpel too. Heads up if anybody is going to use the scalpel, it's extremely sharp. It's designed to cut flesh. So just make sure that when you're cutting with it, you're never cutting towards your own tissue. And you don't want to hold something in your hand and cut it, otherwise you're gonna maybe go through and do some serious damage. So it's the only time I've ever had to send a student to the hospital is somebody who's cut themselves open with a scalpel and has a really, really bad injury of their hand. So let's not do that. Okay, so scissors. What you're gonna do is make an incision, basically the entire abdominal cavity. Okay, so you're gonna go up like this, okay, and then you're gonna cut a flap down here and down here, but you only wanna cut the skin and the fascia on top. So you're just gonna poke through and then try and stay as close to the surface as possible.
Should I start here?
Yeah, start there, yep. You wanna try and just keep it as close to the surface as possible though, because if you're going too deep, you're gonna start like mashing up the organs underneath, so. Just skin and fascia we want. So this is the abdominal cavity. If this was a human, you'd...
Like along here?
You can go around it. You can go around it, yeah. So the umbilicus there, the umbilical cord, is has a big artery and a vein in it, as you might expect, and it goes into the main arteries of the pig. Okay, so it'd be the inferior vena cava and the major artery that runs next to the inferior vena cava. Which makes sense, right? It's like the big artery of the body and the big vein, and it's hooked up to the placenta.
Should I go deeper? Should I be opening up the stomach?
What's that? Yeah, so you want to go deep enough that you're going through the fascia into the actual cavity underneath. Just the only thing I want you to be careful, that's where your diaphragm is, right? That muscle is sitting right about here. And it is a complete separation between the two cavities. So there's no intermingling going on between the two of them. You've got an abdominal cavity and you've got a thoracic cavity above it. And they had to be sealed in between with the diaphragm.
Your
Put here?
laptop is perfect for that.
Put the flap here.
Some students did this. I don't know why they made the organs green. What's that? Yep, you can cut the flap all the way down. Yeah, you can go almost to the back, all the way down. What's that, sorry?
I said it, that's cute.
Yeah, it's a weird choice. We did it for organ donation day. That's what it was. So there's like I think they wrote be a donor or something on the back. But I don't know, maybe we only had green. I have no idea why they're green.
That's weird.
What's that? Yeah, you're doing that correctly. Yep.
Okay.
So that's the abdominal cavity that you're seeing underneath there. And you can imagine those are the intestines. What's that, sir?
Oh no, this is it.
The penis is actually right below. Yeah, that's it. Exactly, that's it right there. Yep. That's how I know it's a male. So if there's a hole right underneath the umbilical
Should I go
cord,
higher into this?
then it's a boy.
How's this?
What's that?
Is this sufficient?
That's perfect. That's
Okay.
perfect. Thank you for your help. Anybody else want to get in here? Feel the texture. Come on out. I'll get you to make a couple more cuts, and then maybe I'll get some people to remove some organs, and we'll take a look at that. It's tough. Sorry, guys. I'd really prefer to do this as a regular lab, but it's just not in the cards. Hopefully you guys can hear this at home. I see that the mic is picking it up, so. Turn the camera over this way. That might help.
I want to get prehistoric animals.
Yes, yeah.
Yeah.
One of the cool things about this is on the inside, it is identical to a human.
Oh, really?
Yeah. Yeah. Organs are, for an adult pig, the organs would be the same size, exactly the same locations. I mean, it's almost indistinguishable. It's kind of cool.
That's fun.
Yeah. That's why you can take like a pig heart valve and put it in a human. Because they're basically the same. Yeah. So you're going to take the scissors and cut a flap down. Try and stay below. This is the diaphragm right here. So you're just going to stay below the diaphragm and cut down here. And the same thing on this side. Cut a flap all the way down so we can see all the internal organs.
So from here I'm cutting down?
That's correct. Yeah, and just try and stay in front of the diaphragm. So you have to look for it in there. You want to go below the diaphragm. I want to leave it intact for now so people can see where it is. So that's too high. Can you see? So this is the diaphragm right here.
Okay,
so you want to
so
cut
like,
above it
Okay.
on that side of the diaphragm. Yep. You got it. So if this was a human, we would be cutting skin, obviously, but below that is the layers of muscle, right? So you got your abdominal muscles and a bunch of fascia underneath. And so that's exactly what you're cutting. Yeah, there's a bunch of goo.
No, how low do you want me to go?
Keep going. Keep going, all pretty much all the way down so we can really hold it open. It's kind of gross in there. The tissue inside does break down a little bit, so it's a little bit gooey. So yeah, it's kind of gross. We'll do our best. We'll try and clean stuff off so you can see it a little bit
It
better.
smells like paint.
Yeah, sort of has like a solvent kind of smell to it. Question?
How do they drain the blood?
So for these, you can get them with blood in. So that's one way to get them. We usually get the ones, this one right here is thermoplastic injected. So what they do is they take a needle and put it in the main artery, and they put one in the main vein, and they pump blue plastic into the veins, and they pump red plastic into the arteries, just to help you identify them. The blood basically just comes out of a hole that they put somewhere else. Normally, they would just give it to you blood and all. The blood just clots inside the blood vessels pretty much immediately and just becomes a goo. So,
Where do you want me to cut for this side? Like, which
same thing. Same thing. So you're going to go straight across and just stay below the diaphragm. It is pretty tough though, eh? Strong tissue. You guys have the same thing. Really tough fascia in there. It's absolutely nothing like cutting a living animal, by the way. If you're curious as to the difference, I did.
Is it easier or harder?
Oh, it's much easier to cut a living animal. Much easier. Maybe not from an emotional perspective, but it certainly is from a physical perspective. I used to work in a lab at UW where we did a lot of work on rats, and so we would be surgically implanting a temperature probe or something like that in a rat, and so I did a lot of those surgeries, and they're much easier to cut. You obviously have to be very careful. You have to give them anesthetics and stuff. I think we take good care of them. Sorry?
is that it?
Ah, sure, that'll work. Okay, I'm gonna then. Is that okay? You good? Yeah. Have a look around in there. Poke around. Have a look. Before you go. Anybody else want to take out an organ? Come on down. Come on, I'll try and get as many people up here as possible.
Do you know what it looks like? It looks like if you had like one of those really long stringy balloons and it deflated.
That's fairly accurate. Yeah.
Cute.
We got some gloves. I'm going to get you to identify the stomach. We'll start at the top of the digestive system. The esophagus is above the diaphragm, so it runs through the diaphragm. And we're not going to get into and it's also at the back of the thoracic cavity, so we're not going to worry about that right now. But we'll start at the stomach. We'll stomach move down. So you want to find the stomach? See if you can find it in there. You're at a bit of a disadvantage because it wasn't on your picture.
Wait, so it's like under.
Oh, can you put the flash on the iPad?
You can't. It doesn't let you do it during video. Only, and even during photography, it won't leave it on.
Even if you go into video mode?
Yes.
Oh.
In video mode, that option disappears.
Didn't it used to do that?
Did you used to be able to turn it on while you're filming video? It's never worked for me. Try it. It did. The last time I looked into it, it did not work. So switch to video, you're saying, and then put the flash on.
It doesn't work.
Get out of town. It does work.
Oh, it does.
I wonder if they changed that feature.
I don't know, it doesn't work on mine.
Yeah, I'm not arguing. It works. It works. Cool. See, did you find it?
No.
Poke around in there. Don't be shy. You might want to roll your sleeves up, but that big thing that you're poking right there, that's the liver.
Okay.
Yeah, it's the largest organ in your body, so it's real big.
It's like blue. What is that?
So the reason it's blue is that's the thermoplastic coming up through the tissue. They
Oh,
pumped
okay.
it in there. Yeah, so it's not actually blue. It looks sort of like a purpley red color.
Okay.
Don't take the colors that you're seeing here to
yeah.
Yeah, because it's been sitting in preservative, so a lot of the color changes in the preservative. Like, you guys see the video of the heart? Like, that looks nothing like a heart. Like, the heart is like bright red. Like, it's a very red tissue when it's a fresh heart. So I just didn't have a fresh heart when we did last time.
Where is it?
How old?
The feet.
Like, how long has it been sitting in preservative?
Yeah.
Probably a year.
Whoa.
It's been around a while. They sit for a long time. In this preservative, they keep for like 10 years, a long time. So, what's that, sorry?
I don't know where it is.
Okay, no worries. You gotta look underneath the liver, and then you might see a little sac.
Oh yeah.
See that sac?
Oh, Mikey's got it.
There it is right there. So at the top of the sac, you're gonna see the esophagus. It's actually right there. I don't know if people can see that. Up here is the esophagus just coming through the diaphragm. And underneath the liver, can you guys see this little green sac on the liver? What do you think that is? Gallbladder. So that's the gallbladder right there. And if you follow the gallbladder down, you got cut. Oops. That was it's okay. You accidentally cut it. It's not a big deal. This is the bile duct. So this little tube goes from the gallbladder into the small intestine, right? That's where the bile goes in. Oh no big deal. I mean, this guy's gonna get totally cut apart. So you can snip this. There's some arteries at the back of it as well. Those are the mesenteric arteries that are supply blood to the stomach. You can just cut those. And then at the bottom, you'll see that it's attached to the first part of the small intestine right here. This is the duodenum.
Oh, yeah.
So you just want to cut at the top of the duodenum. Okay?
Okay.
So then we're going to take the stomach right out.
Scissors?
Yep, I would use scissors. Yeah, you can use the scalpel, but it's a little unwieldy to cut with. I wouldn't recommend it.
So I'm cutting it like right out of like.
Yep, so top, you can cut right across all the esophagus, the arteries, everything, snip, 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 go all the way back. And then at the bottom where it's attached to the small intestine, snip, 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 cut it off.
Okay.
You'll be fine. Don't worry, you're doing a great job. It's taking a little bit more time than I was expecting. Sorry, I may have to jump in here, but in a minute. But I think I'm going to have to give you guys some time to work on the project tomorrow. How are you guys doing with the project? Haven't started. Okay, some of you might be in that boat. I'll try. I'll give you some time tomorrow. I would recommend using some of Learning Block 3 today to work on it as well. But I'll give you some time tomorrow.
Am I cutting this?
Yep, you're gonna cut all the way through. Because we only have till 12:50, right? Is that right? Yeah, okay. It's been so long since I've spoken to somebody. I've been at home for a long time. I mean, I talked to my wife, but so I think I'm being a little long-winded today. Sorry about that. That's
That's okay. It's a little better on a live stream.
Oh yeah.
okay.
More
A lot
engaging.
better.
All right, good. So that's the stomach. There it is. You got it.
Lots of stuff coming out of it.
It's pretty big.
Get that thing.
Ew.
What's in there is something called meconium. If you've ever heard when a baby is born, human babies do, their first poop is like this black, sticky ichor. It's really gross. It looks like tar. And a lot of new parents, when they see it, think there's something wrong with their baby. It looks ridiculous and it's gross. What that is, that's what the same thing. It's called meconium. And when your digestive tract is forming, it's like sloughing off dead tissue and stuff like that as it's forming the cavity on the inside. And all of that dead tissue and stuff is accumulated in their digestive system, right? So it's just sitting in there, and then when the baby is born, it has to pass all of that dead tissue out, and it's like this black,
Yeah, it's not reassuring that it's black.
and it's very sticky. It's like tar when it comes out. Yeah. If I didn't know to expect it, I would have been very worried when I saw that at my baby. So there, awesome, great. You're showing the inside too. I'm just gonna show the inside here.
Yeah.
No, but like.
You'll notice there's some folds in there. They're not fully mature yet, so you can't really see the folds too well.
Yeah.
But eventually there'll be some fairly deep folds in there. And you guys talked about that tissue inside that produces the hydrochloric acid, right? And some of it produces pepsinogen.
Oh.
Yeah, so that's actually made in those folds in there. Cool, thank you. Much appreciated.
Hold on.
I should probably have a little
Why
area
would
here,
they
right?
tell parents the black food?
They're not really good at informing, they're just very good at baby.
No, but they're informing too.
Not that much.
What are you guys talking about?
Like, why would they inform parents about that? Like, their first two or something?
Well, there's a lot going on when a baby's born. And oftentimes after the baby's born, there are people resting. There's it's quite a thing, and they do have to tell you about a lot of things, breastfeeding, whatever. Maybe they mention it. I can't remember if it was mentioned to us, but it's a pretty there's quite a lot going on during a childbirth. So it wouldn't be surprising if someone missed that part. Anybody else? Yeah, come on down. I'm gonna get you to take out the small and large intestines. I think you can find them.
I was hoping I could.
I unravel them.
Yeah, you can try. Keep in mind that in between those branches is a lot of arteries and veins. You guys talked about this. That's where the actual nutrients are getting absorbed and going into the blood, right? And the lacteals are there as well. So there's this network of vessels that are going in and out of the small and large intestine. We'll be able to take a look at it in a second here, but it's quite attached together. So.
This doesn't look real.
I assure you it is.
Should I like cut it out?
Yep, cut her out. So they're attached at various attachment points along the back.
Oh, good.
Yeah.
One of the things that I find really interesting about this that you may not have known is that like you just have like a cavity there. I don't know, for some reason as a young person, I assumed that everything was attached more on the inside, you know? But it's really not that attached. Like it's fairly, the organs are fairly independent inside. Like they are attached, don't get me wrong. There are attachment points holding it in the correct position in your thoracic cavity and in your abdominal cavity, but it's not that much. Like it's pretty loosey-goosey in there, really.
Wait,
There's
what is?
not that much wiggle
Did I get
room,
it
though,
right, or is that?
There's not that much what, sir?
Like wiggle room
No,
when it's closed?
not at all, not at all. There's no air in there, so.
Where are the ribs?
All in the thoracic cavity. So we're below the ribs right now in the abdominal cavity. Yeah, we'll go up there. Yeah. I'll get someone to cut through those ribs.
Like,
Yeah, you can cut it.
okay.
Anything in the way you can cut. So you'll notice also that the intestines take up quite a bit of room in the abdominal cavity. They're long. If you actually take these intestines and you lay them out, it's a couple meters. It's long. So.
I don't know what it is. Is that this is the small?
Small intestine.
So differentiating between the two is actually quite difficult.
Okay.
This is all small intestine up here. And what I meant when I mentioned those arteries, can you guys see that?
Yeah.
So there's a network of all these tiny little arteries and lacteals that are going out of the intestine. That's where all the nutrients are getting absorbed.
Is that poop?
It's not poop because it's meconium.
Okay.
So this is an unborn. It's never eaten
Yeah,
anything, right?
okay, yeah.
So this is all small intestine here. You can see that. That's really cool. So large intestine's right here. There we go. I just got it. This little loop right here is large intestine. Actually, no. Wait, what the heck?
Does it not have one?
No, it has one. Although I will say that once we found a genetic anomaly where there was no liver in a fetal pig, so it would have died immediately on birth. But we found one that didn't have a liver, so which is really cool. So that does happen. It may actually have already been dead.
Is it not bad?
This is all small. I'm looking for the appendix. The appendix, right there. Is that appendix? Oh, maybe not. There's the appendix. There we go. Okay, so here you can see this right here is the end of the small intestine. Right at the end of the small intestine is the appendix, which is this. See that? That little guy? So that's the appendix. So you got that right at the beginning of your large intestine, and if you keep following the tube after that, everything after that point in this direction is large intestine. Okay? they're not actually that different diameter-wise. They're fairly similar, keeping in mind that this is a fetal pig. So it is going to grow a lot, and so the difference between small and large intestine is a lot more significant in an adult. But it's not super significant here. Thanks. Did you want to take a look at it? You can have a
Yeah, I
look.
kind of want
Go
to
for it.
touch it again.
Absolutely.
You want it on the paper towel?
For sure. Yeah, you just put it over there with the other organ.
You made it all warm.
Sorry, that's gross.
Yeah, a little bit.
Sorry.
Okay.
I'll try not to think about that too much. Okay, and then, of course, at the end of the line there's a slightly larger cavity, which is the rectum. And that's where the waste is being held before it exits. And then at the very end of the line, we have the anus. So the anus is just underneath the tail. Boop, right there. Okay. Who's up next? Have you gone already? No, come on down. I'm going to get you to snip out the liver, just so you can show everybody how big the thing is. It's a giant. What are we doing? Oh, I'm going to wrap this up pretty quick here. I may have to jump in after you go, okay? Is there anybody else that was hoping to get up and cut? Did you want to as well? Okay. Of course. Absolutely you can.
Oh wow, really looks great for this angle.
Well, I'm really glad that light works. That was a great suggestion. Thank you for
Yeah,
that, whoever
that's a
said
big
that.
difference.
Awesome, thank you. That really helped a lot.
Okay.
You should have went for the large glass.
Yeah, I should have.
I always try and squeeze the mediums on it. There's no point. All right, you want to remove the liver? It's the big organ there in the bottom of the abdominal cavity, and then I'm actually going to get you to make the first cut up into the thoracic cavity. I'm going to get my next volunteer to cut out the lungs and the heart, if that's all right.
Where?
It's that big organ in the middle of the thoracic cavity, or the abdominal cavity, rather.
There? Oh.
That's the liver. I shouldn't say the
Oh.
middle, it's at the top. It's at the top of the cavity. So it has a big artery coming out the top, hepatic artery. And that artery, by the way, comes basically directly from the large and small intestine. So it's the first stop for all of your nutrients once they go into circulation, is the liver. The liver does a lot of organizing, a little bit of chemical reaction stuff to kind of package that all up for the body. It also stores most of the sugar that you ingest. So you store a little bit in your muscles, but the liver is actually a huge storage area for sugar.
Very attached.
It sure is. That one has quite a few attachment points. It's a hefty organ. It'd really be jumping around in there if it wasn't attached pretty hard.
Oh boy.
Oh yeah.
That is sound effects,
Oh yeah.
Alex.
Nice.
There we
Okay.
go.
Awesome. You can just drop that off. I don't know, guys. Notice how big it is. It's big. It's quite an organ. A lot of chemical reactions going on in there. So what I'm going to get you to do is cut straight up through the ribs. Sorry.
Mhm.
So there's going to be some bone in here they're going to cut through, but stay surface, just like these cuts. Okay. Surface, and then you're going to cut above the arm, all pretty much as far down as you can go, and up here as far down as you can go. Okay. So up and then across. We're doing some time here. Oh. Okay. Stay on track here. I'm definitely not keeping this in the class overnight, so.
Yeah. I mean, we're not here tomorrow, so we don't have.
Oh, you guys are not here tomorrow. Oh, it's a switchover.
Yep.
Oh, okay.
So
I
feel
should probably
free to
have
keep
known
it if you want.
No, it's okay. Once you take the preservative cloth off, it does start to go off. So. It's challenging. You're doing a great job, by the way. The purpose, you're gonna have to cut your bone, sorry. I think that's it. You're trying to avoid the bone. It can't be avoided. You gotta cut the ribs. The
I don't wanna go too deep, but there's nothing there, right?
yeah, there's really nothing to get there. You'd be cutting into like brachial plexus. It's like muscle nerve. That doesn't matter. You cut all that stuff. It's not like a surgery. You don't have to be too careful where you're cutting. It's fine. This guy will never need this stuff again.
Yeah, probably not.
Yeah, when we did surgery, I mean, you gotta be careful. You gotta be good to those guys.
Rats intact.
Yeah, you don't want to cause them any kind of undue suffering either.
Go back track.
Oh my gosh.
I took care of them. We put like Vaseline on their eyes and stuff, and
Oh,
yeah, so their eyes don't dry out while they're in surgery because they don't close their eyes.
That's cute.
they don't close their eyes ever.
It's once you're giving them part of what you're giving them as part of their anesthetic is a muscle relaxant, so it actually just their eyes just kind of float open. That happens with people too, by the way.
People get them like taped closed or
Yeah. Close them up.
Imagine if you're mid-surgery and then the rat eyes just float open.
I monitor all their vitals, just make sure that they're actually unconscious. Keep them on a little heating pad so they don't get cold.
Okay, so it's not as violent as it sounds.
Oh, I'm very careful with them. I wouldn't want to. I don't want them to be in pain or I mean, they're still a little. They don't understand what's happening, so it's stressful for them. But
More or like
yeah. How far are we gone here? Oh yeah, you cut through all that. Bam. Just,
Okay.
I know. It's bone, right? So you're like, I don't want to get in there, but you gotta.
Alright.
If it's really bothering you, like I'll shear it open, but. Can you guys see the heart in the middle there?
yeah.
That's a heart.
Hey.
I think you're trying to cut through like a big bone.
Yeah.
That's probably fine. Try the other side. Try the other side. Yeah, I'll just pull it apart from there. Oh, one of the things I didn't notice was the pancreas. Sometimes the pancreas is fairly fragile, so sometimes it just disintegrates in the abdominal cavity. So I didn't actually see it in there, so it might not be in there. I mean, it was in there, but it probably disintegrated, like it gets rubbed apart.
Aha.
It would have been just underneath the stomach, by the way. Usually you can
Is
see
he
it in
open
there.
enough now?
Yep, that'll work. Do you want to take the organs out too? You can.
Okay, sure.
Sorry, it's really crunchy. Sorry, I know that's like a very not a
It's like
nice.
bubble wrap.
It actually really does sound like bubble wrap in like a really gross way.
Oh yeah.
There we go. Okay, so what we're looking at right in the center here is heart. So you'll notice, guys, that the heart is pretty much in the center of the thoracic cavity. It's pretty much in the center of your chest. People have this idea that like the heart is like way over on the left side of your body. It's not way over on the left. So it's pretty much dead in the center, but the apex is towards the left. So there is one less lobe on your lung on the left side, and that is to accommodate the space from your heart. So it is to the left, but it's not over on the left. So it's not like the whole thing is over here. It's kind of more like whoop, in the center. All right, so if you want, you can cut. Did you want to get in and do this cutting? Wait, who's the one to cut? Yeah, all right, come on down. Last few cuts here. We don't have much to go. So by the way, encasing the heart on either side is obviously the lungs. So these are the lungs on each side. This tissue right here, you notice that there's multiple lobes of lungs. So I think I talked about that on the day we talked about respiratory illnesses. We talked about lobes. You could have a lobe removed. You could have a cancerous lobe or something. It's hard to make cuts in the middle of the lobe though, because there's so much blood supply. So. Is it? Yeah.
Yeah.
So much realer.
So I just like.
Yeah, you're gonna go across the back and just there's
Oh,
major
right.
arteries connecting everything, so you're gonna have to snip them. Yeah. You just cut it all. We'll get the heart out of there. I'll quickly just show you the surface anatomy of the heart. You guys have already seen a heart, but atrium, ventricles, so you can see it. It's exactly the same as your heart.
Is that like blue plastic in there? Is that
It is, yeah. So that is, okay, here guys,
Is that solid?
main artery below the heart, or not main artery, main vein coming into the bottom of the heart.
Is the plastic solid?
What's that one called?
What's the main vein going in?
From the bottom.
Aorta?
Oh, aorta is the artery. Oh yeah, this, vena cava, but which one? Which one means below? Inferior. Inferior is the Latin word for below.
That's not the heart.
Are those like the little arteries?
They are. So this one right here is the coronary artery. That's this one. This is showing up in the camera. That's not coronary, pulmonary artery going to the lungs. And then on the other side here, this big loop that's going through here, including this right here. Put that on camera right here. That's the aorta. Just while you're doing the cutting there, I'm gonna grab that heart. Sorry, we're jumping here. Just want to show people at home this. There's the inferior vena cava right there, coming from the bottom. There's also a vein. Right, this other vein that you can see right here, this blue thing. That's the superior vena cava, and they're both going into the right atrium, which is here. This thing. This on the other side here is actually, right atrium right there, and then the left atrium. Oh yeah, let's pull this cover off right here. Perfect. This is the other atrium on the other side of the heart. So we've got, oh, I got it backwards. Right atrium, left atrium, right ventricle right here, left ventricle right here. The apex is on the left side. There we go. Looks sort of like you remember, hopefully. And those are the lungs. So you can see that there's this great big artery going into the lungs. That is the great big artery that goes through the lungs.
Is that this piece here?
Pulmonary artery. What's that, sir?
Is that this piece here?
That is the pulmonary vein.
How big is
So that would be going back to the heart.
Okay, going back.
Yep.
It does smell like paint.
A little bit, yeah, solvent. There's like a solvent in it. Gross. So you also notice the lungs are real big, and those are deflated, never drawn breath, right? This is from unborn. And so the moment this pig is born and starts breathing, they expand quite a bit larger than that. So the thoracic cavity gets a little bit bigger to accommodate the extra air in the lungs.
You with the syringe pump air in?
Now that it has been sitting in preservative for a long time, no, because it would probably just bust. If you were to take this fetal pig fresh, you absolutely could just fill it up with air. In fact, I used to do this in the class. We could get a pig, or not pig, a cow, like a grown cow's lungs from the slaughterhouse, and you can get an air compressor, and you can just pump them full, and they get huge. You can see how elastic they are. They really fill up with air. That's kind of cool. I don't have a source for that one anymore. They only do pigs at the slaughterhouse outside town. They don't do cows. So I don't know anywhere I can get that. I used to get it from another butcher, but he's like, oh, I don't get lungs anymore, which I guess makes sense. I don't know who's eating them, but anyway, guys, I'll probably just call it right there. That's a fetal pig. We went pretty much through all the major systems there. Tests or quiz. It's a quiz. Whenever you're ready to write it, it doesn't have to be today, preferably by midnight tomorrow, okay? Try not to put it off past that, I wouldn't recommend it. But if you need some help, you want to review something with me, something is still not clicking for you, and you want to do that before, drop by during Learning Block 3 today. I'll be in the Google Meet, like let's chat, or you can chat before you leave. But let's definitely talk about that before you write the quiz, okay? Assignments, you guys know that the medical technology assignment is due technically tomorrow at midnight, okay? Again, if you're taking an extra day, it's not a big deal, just drop me an email. And the same thing is true for the vocabulary list, tomorrow at midnight. So far, people have done an excellent job with that. Please, before you do it, before you hand in this vocabulary assignment, have a look at the comments that I've left behind on your previous assignments. Please look, okay? If you got 11 or 10 out of 12, there's a reason, and I've very clearly indicated the reason. Take a look at it. It's probably a quick fix that you can just fix on this assignment and get yourself 12 out of 12, okay? But I did leave comments behind. It's not like it's not a mystery, okay? So have a look at it. If you're not sure about something, don't be afraid to email me, okay? And if you need an extension on anything, let's talk, all right? Okay, cool. I'll let you guys get to work. I mean, you can't leave, so if you just want to work for the next little bit on your assignment, you're welcome to do that. You still have 10 minutes, so just chill. We can't go anywhere, so for the people at home, same thing. If you just want to work on your assignment, you want to get started on the quiz, you're welcome to do that. I'm going to clean up this pig.
Can I look at it?
Absolutely. If you want to come and have a look at it, please feel free. The organs are sitting out there for the most part. Back over there. Hi.
Can we like grab another set and feel them?
Yeah.
Gloves?
Of gloves? Yeah, go for it. Absolutely. You guys just keep your distance and you'll be cool. No problem. Went to
Just want to grab some
here, sorry.